Let's look just for a minute at the slide again and see that the ganglia on the sympathetic side, as shown here, lie very close to the spinal cord. When we dissect these in cadavers, we actually are only going out about an inch from the spinal column when we see nerves that have these little swellings, and this is called the sympathetic chain. And if you look more closely at this, here's the actual fine anatomy of the sympathetic part of the autonomic nervous system. What happens is sensory input comes in just the way it does anywhere else, in the posterior horn. But here's the first neuron in this system. It goes out through the anterior root, and it starts to go down as if it's going out the spinal nerve. But look what happens. It makes a short little circuit here, and this is called a ramus communicante, a little communicating branch, and it goes into the ganglion. There's that swelling with the nerve body, and then it can go out through its effector nerves to another ganglion that may be near the organ itself, in this case, a piece of intestine. Now, the function of the two systems, as I mentioned before, you could memorize what it does to every organ, but you could really figure it out. If, for example, you look at the pupils of the eye, we want in fight, flight situations to have the maximum amount of light. At night, we do not want to be running through a forest with our pupils constricted. So what does the sympathetic system do? It opens up those pupils right away. Somebody who's frightened, their eyes blow up like that immediately. We have the opposite in the parasympathetic. We want rest, relaxation, and darkness. The pupils close down. If we think about what's the heart going to do? Well, the heart is going to be whipped by the sympathetic system, by adrenaline, by epinephrine. It's going to increase its rate, the force of its contraction, stroke volume. Blood pressure is going to elevate. Distribution to the vessels of the muscles are going to be opened and dilated to give all our skeletal muscles their maximum flow. It's very, very chemical reaction emotionally. One of my professors, who is very educated in physiology, told me that he was sitting in a dentist chair once. And dentists have adrenaline or epinephrine in the xylocaine they give you. And the reason they have a very little bit of adrenaline in there is because xylocaine causes constriction of certain vessels so that it can elevate the blood pressure, and it will help stop bleeding. But in the dentist's case, it keeps the Novocaine or the xylocaine near your tooth longer because there's not as much blood flow. So this professor of mine was in the chair. He got his injection, and some of it accidentally got into a vein, not into the tissues. He got an intravenous injection of xylocaine, which isn't so good to have. But worst of all, he got the adrenaline. He said he went completely crazy. He could feel his heart rate increasing till it was pounding in his chest. His face was flushed. His blood pressure rose. His pulse was pounding in his ears, all of which he expected. But his terror was almost uncontrollable. He said he sat there gripping on to the sides of the armchair so that he wouldn't run out of the room screaming, and it was all he could do. He even said to the dentist, "I'm having an adrenaline reaction, and I'm terrified, and I know it's chemical." And he said no matter how much he told himself it was just chemical because there was no threat, it was all he could do to contain himself. He became almost completely irrational and just was able to at least not knock down the dentist and go running from the office. It's very, very powerful stuff. It's survival at its most basic. And these chemicals in very small numbers of molecules are very, very potent. What else would these systems do when you think about it? Blood glucose, blood sugar levels. What would it do to blood sugar? Well, the sympathetic side is going to raise the blood sugar levels. We need all that energy. The rest and relaxation side, the parasympathetic, is going to depress it. It's going to knock it back into the cells so that it can be used for building blocks to recover